Ele Kessler, Hamasl, Medligame, Hewakilis, Yaitlan Lacha, Uyukumai, Yaila Dzawada, Musma Dzawada. Yahin Ganam Khani Samega, Yaila Namgis, Luida Mamalelakla, Abampes and Kunuk Malas Lumalitas.
Our people were known as the Muskama Dzawada, and that means 4 tribes. All the 4 tribes worked really well together. I would say in the first 8 years of my life were really happy ones. I was still home with my parents, and we lived in the 2 villages, depending on the season.
And back then, a lot of people shared what they had, you know, it wasn't just, this is mine.
We didn't really need to go to any stores. What met our needs was provided by us harvesting. One of the things that was so important to our people was that we know each other, that we respected each other.
I am reminded of the privilege that I have been given by the Creator and our ancestors to be able to live here. And it increases exponentially when I have children and know that they're going to have that same opportunity.
I've lived in Kingcome all my life. I love that it's so quiet and we're surrounded by nature and there's a lot to explore.
This is where I belong. I have roots here. I have family that are buried here. My ancestors fought for our land here.
What keeps me here is my family and knowing that our ancestors have lived here for thousands of years and that we still get to call this place home.
In this day and age, it's considered that it's quite remote, limited access to healthcare services, even everyday supplies like running to the grocery store. It becomes a 10-step process rather than it is just getting to a vehicle and going out of the grocery store.
It would be really important for me, for a health provider, to know before they came into the community the historical events that have directly impacted the generations that are here today, particularly the older generations.
They're going into a world that they most likely have never gone into before. So being properly brought up to speed is vitally important.
Residential school was not a million years ago. Literally, there are survivors in this community.
My father was forced to. He was forced to send the youngest ones to the residential school. And that really, really broke our family up.
Each and every one of us are in a different place of healing. Each and every one of us are in a different place on our journey through significantly traumatic events that they've experienced and lived through.
I was pregnant last year. I made it to about 19 weeks and I didn't realize what was going on. But when I did make it to the hospital, they said that I was leaking amniotic fluid. And I would say that I was probably doing that for a couple of weeks and not realizing it. Within about a week of me being in the hospital, I lost baby.
Being a remote community is very challenging when we talk about health, especially around medical emergencies. It takes a couple of hours just to get into community. So when we're talking about a medical emergency, that golden hour term is right out the window.
I mean, if we're into fire season and if all the helicopters and planes are being used, then we're on our own, basically.
We have had problems, even our nurse had problems. Trying to get them to come in for somebody, it's like, is this a life and death situation? Do they really need to get out? When I first started working here, we used to call the doctor, and it's really his call. Yes, they need to get out, I'll phone 911 and they'll be in there. Now we have to phone 911 and convince them that yes, this person needs to get out.
We started training some of our people to become what they call first responders. What I'd like to see is more of that happening, more training, so more of our people are more equipped in knowing what to do if there's an emergency.
I think for maternity, there should be more information out there, and the women who live in isolated areas should know more about, if this happens, then you should contact us. Because I thought it was a minor problem. I didn't think that it was such a major problem.
It's also difficult in regular healthcare when we have a clinic day and our fly-in team, which consists of our general practitioner, our nurses, our lab technicians. They come in every 2 weeks, and it's very hard to predict whether they'll make it in, especially in the winter and the fall seasons, because of the weather being so dramatic and drastic. So if they don't make it in, we end up having to wait 2 more weeks.
I don't receive my medications in a timely manner when I'm needing them, or if something's going on, I don't get that visit right away with the doctor or nurse.
We had one of our diabetics told by the doctor, we're going to put you on insulin, we're going to order it and it will come in. Well, it never came in, it never came in, it never came in. A whole month went by and they were like, what? And by this time he's mad. He's one of the older guys and he just said, I'm not going on insulin. So it makes it hard because his health is at risk.
The people of Kingcome Inlet have experienced racism and discrimination when accessing healthcare on multiple levels.
Through my experience in the health profession, I have witnessed it, I've experienced it, mainly when we're traveling out of community for services. There's a lack of respect, there's a lack of empathy.
Rather than looking at the issues at hand or doing a full assessment and providing that kind of adequate overview and care for them, they jump to the assumption that they were drug seeking. And that's real stereotypical in my mind, and it's something we hear a lot of across the board when we talk to a lot of the people that live in the community and have to go out there.
They asked me if I wanted to go to Victoria and do my chemo stuff, like pills and stuff, and I told them I'd rather be home doing this instead of out there.
It's sad that it's still going on. It's 2019, we shouldn't be facing that today. Nobody.
We've got to figure this out because people are dying 100% preventable deaths because of stereotypes and assumptions, because of racism and discrimination. And it's a heartbreaker. Nothing will work until we fully grasp that this is ours to control. To empower people who, for generations, have been told they have no control over this has been more of a struggle than I thought it would be. It's just understanding that trauma-informed practice and journey around allowing and creating that space, regardless of where each individual is at, around having that voice and capacity to take on their own healthcare.
Part of what I want to do is to be able to bring our kids out and start harvesting our own food and that again. Get them back into, eating like our old people did.
Well, ever since I've been diagnosed with colon cancer, I've just been, I've been doing good so far with it. I just, keep myself healthy and then work-wise and stuff like that, and eat the right food. Like I was saying earlier, I just live on Indian food mostly. My
dream is to see people finding a way not only to pull what they can or need from medical model or issues. There's so much else out there too, but also going back to our traditional ways.
Staying here and having this place home for our future generation and having everything we have.
Unity, culture, tradition, those are, to me, very important. And without them, we can't have health and wellness.
I look at the valley, I see the beauty, we're free.
This place defines who we are, and we define this place.
This is where we belong. This is where we were born, this is where we were raised, and this is where we will die.
I'm not going to be leaving my land.
We have to find our way as a nation and as a community that's so isolated. We can't grab onto something as quickly as this minute. We have to be strategic about it.
And ensuring that we have adequate health care is very important, not just to me as a parent or as a community member, but to all of us as a people.
It's time for us as a society to define what reconciliation means within the healthcare system and start unraveling that together.
There's a one word in our language that says "kalkaposa," and that means holding hands together.
True reconciliation isn't going to be one group with ideas over here and one group with ideas and then trying to do it. We've got to come together. We've got to be united. We've got to be like-minded, and we've got to be on the same page.
We do believe in that. We believe that we will be able to work together.